earlier in the conversation, you told me that I should be careful what I upload to AI or tell AI, especially using something like ChatGPT, because the things that I input there are not protected by HIPAA.
Correct.
Can you tell me a little bit more about that? What is HIPAA? What is protected by HIPAA?
So HIPAA is the Health Information Privacy and Protection Act. And it basically says that your clinician, your healthcare system, your insurance company just can't go giving your medical information to anybody that asks, right? There has to be consent, and there has to be a valid medical reason for this information to be exchanged. And if that does not happen, there are consequences to whomever didn't follow the rules and put your information out there. Example, when famous people go into the hospital and we find out, ooh, you know, Cardi B is pregnant and she didn't release that information, somebody violated HIPAA, right? In putting that information out there, because that's not what the law says is supposed to happen. In the context of putting your information into any of these internet entities, you have zero protection. So if I upload my entire health record because I want to see if it can detect any types of patterns that could suggest that I might have some disease in the future, even though I don't even have a disease now, but I'm going to give it everything because I want to see if it can find a pattern that says I might have cancer in the future, right? And this is a thing that people are doing. Your menstrual history can be used to go figure out whether or not you're pregnant, you know, premenopausal, postmenopausal, right? To either sell you products, to either offer you things, not offer you things, right? Any of that information can be sold either as identified to you or de-identified, meaning it doesn't have your name on it, but it's all the information about you. De-identified is a common way that entities will say, we sell your information or we distribute your information, but no one knows it's you because we've taken all the identifiers off that. Well, it seems safer, right? And in many cases, we don't necessarily know that it's you. But let's just say you live in a small town and there's only 3 accountants in town, and only one of them is between the ages of 50 and 60. Well, we know it's you. Yeah. Right? Like, we didn't have to figure it.
You can re-identify
Yes, you can. And there are, and while that was a really simple example, as you can imagine, there are sophisticated programs that can re-identify data and who you are. So it is the world that we live in, right? Where your information is out there. But at this point in time, I think, especially as adults, we have a responsibility to decide, of the things you can control, where do I want my information to go, right? And there was a time when we didn't know, you know, that the pieces were going all the ways that they're going. In the same way, you know, kids and things, they don't necessarily realize, because they're young, right? All the different ways that once you put it out there,
it's out there. So help me understand, like, in which cases is my data falling under being protected by HIPAA? So, like, I understand if I go to the doctor, I go to my primary care physician and I talk to them about stuff, that's protected by HIPAA.
Correct.
If I go to the hospital, that's protected by HIPAA.
Correct.
But what are some other instances, like if I talk to my mom about, you know, the piece of my health information, that's not protected by HIPAA?
Be sure to ask yourself if there's a financial exchange, right? If something's to be bought, you definitely want to be thinking about who's telling me to buy this, right?
Yeah, and are they incentivized to do so?
Right. And, you know, who does this help? Who might this hurt, right?
Who does it benefit?
Who does it benefit?
Yeah.
And then Lastly, I would also, well, two things. And lastly, still engage with a certified, trained primary care provider that you trust, and take to them the information that you found and say, hey, listen, right? I found this and I'm thinking of trying this or stopping that or whatever. You deserve to have a provider in your life who you can have that conversation with, who then you can have an honest exchange about, okay, with your history, right? Worth a shot, won't do you any harm. Give it a go, right? Or hold up, don't do that. Because remember, 2 years ago, you had that kidney issue. And since then, we're keeping a real close eye on X, Y, and Z.
Yeah.
Right. That level of context is missing. So that's why the augmentation, the assistance is still needed when you're trying to, navigate all of this information. Patients are not the only people who have a responsibility. I'll say that. Healthcare leaders, healthcare policymakers, we absolutely have a responsibility to make rules that facilitate transparency in the tools that we are releasing out into the community. We have a responsibility to require, notification that this was generated from AI, right? Or the ability to understand what this was trained on or how it was trained. We have a responsibility to put those rules in place as healthcare leaders to make sure that our patients are protected, our community is protected, the general population as well is protected. So there's responsibility enough to go around.
100%.